Hello and welcome to the Shoreline Community College's Health Informatics and Information Management HIIM program's informational video. I'm going to take a moment and walk you through some of the key components of our programs, application process, and various other elements within the health information field. Our programs. We offer two programs. One is the Health Information Technology Program, and the other is the Medical Coding and Reimbursement Specialist Program. Both of our programs are 100% online. The first program is a 2-year degree program, and it is for the AAS degree. Students also take classes in the summer quarter between the first and second year. Students who wish to receive an associate's degree within health information technology are then eligible upon graduation to sit for the RHIT credentialing exam through AHIMA to locate more information about the field of health information and health information technology. You can visit AHIMA at ahima.org. We also offer the Medical Coding and Reimbursement Specialist Certificate. It's a certificate of proficiency, which is 5 quarters in length. Students take either the Medical Coding and Reimbursement Specialist program or the HIT program. However, we do have numerous students who do both programs, as the first year of the Health Information Technology program also encompasses the Medical Coding Reimbursement Specialist certificate. So students have an easy access into the 2-year program if they wish to continue from the certificate program. After graduating, students then could sit for a coding credential through AHIMA or AAPC, and I'll cover those in a moment. To learn more about the programs and health information, you can visit this link, and it provides you with access to the planning guides for both of these programs. From there, you can learn more about what the programs entail, the courses offered, and the durations. Applications for admission into the health information programs opens mid-January and closes around June 30th each year for admission into the academic year starting that fall quarter. Program accreditation and approval. The American Health Information Management Association approved the Medical Coding Reimbursement Certificate Program. We at Shoreline Community College are the only AHIMA approved coding program in the state of Washington. The Commission on Accreditation of Health Informatics and Information Education accredited our HIT program. What we specialize in. Health information management is the practice of acquiring, analyzing, and protecting digital and traditional medical information vital to providing quality of care. It combines business, science, and information technology. I always like to say that we do many, many things in the health information field. There's many aspects of our job. We all perform different aspects, and it's been a true pleasure to work in the health information field throughout my time. We're also experts in managing patient information and medical records, administering computer information systems as well. We in health information are highly trained in technology applications, so we understand the workflow in any healthcare provider organization, from large hospital systems to the private physician practice. We're also vital to the daily operations management of health information and electronic health records, known as EHRs. We also ensure patient health information and records that are complete, accurate, and protected. Where do we work? We work in a variety of different settings and job titles. We bridge roles connecting clinical, operational, and administrative functions. We affect the quality of patient information and patient care at every stage in the healthcare delivery cycle. We work on classification of diseases and treatments to ensure that they are standardized but for clinical, financial, and legal uses in healthcare. We also care for patients by caring for their medical data. We're responsible for quality, integrity, and protection of patients' health information. We adapt a new technology of capturing healthcare information, storing that information, and easily assessing it electronically. So why choose a career in health information? You might have versatile skills that might enjoy working with clinical information technology, leadership and management skills, to form links between clinicians, administrators, technology designers, information technology professionals, evolving regulations and technologies that allow for lifelong learning and continued professional development, to provide the patient data needed to successfully navigate the changes. The health information professionals expect to be in high demand as the health sector continues to expand, and demands are on the rise at all levels of education and credentialing. Approximately 12,000 to 50,000 new jobs anticipated by the Bureau of Labor Statistics, and medical records and health information technicians are one of the fastest growing occupations in the United States. Various industries for health information professionals. Healthcare organizations encompass inpatient and outpatient settings, academic institutions, consulting agencies, government agencies, healthcare software companies, critical components of the electronic health records workforce, and encompass new support positions, including mobile support adoption positions, public health informatics, implementation support specialist, and information management redesign specialist. Is a career in health information right for you? Are you looking for one that offers diverse opportunities to work in a healthcare setting but not directly with patients? Have the aptitude for science, management, law, and computers? Enjoy working with professionals, physicians, nurses, lawyers, administrators, and executives? Is a career where you can choose to work on your own, with others, or some or both? Let's take a moment now and walk through the various credentials. There are 2 credentials that require graduating from an accredited institution, just like Shoreline Community College. For the bachelor's degree program, one could then obtain the credential or an RHIA, so a Registered Health Information Administrator. Those persons graduate from a HIIM, Accredited Health Information Administration program, and then they sit for successful performance on the AHIMA RHIA certification exam. For the RHIT credential, students sit for the Registered Health Information Technician credential based on an associate's degree, who have graduated from a HIIM accredited HIT program, such as those from Shoreline Community College, with successful performance on the AHIMA RHIT certification exam. There are a variety of coding credentials, and I'm only going to list a few here. The first 3 are through AHIMA. The most challenging one to obtain or sit for is based on more experience with the inpatient side of coding. Usually it's based on 1 to 4 years of inpatient as well as outpatient coding experience, successful completion of the AHIMA CCS exam. The CCSP is the Certified Coding Specialist Physician's Office. This is 1 to 3 years of outpatient coding experience, successful completion of the AHIMA CCSP exam. And then the third one is the Certified Coding Assistant, which is based on 6 months to 1 year inpatient, outpatient coding experience with successful completion of the AHIMA CCA exam. For our students who graduate from either the coding or the 2-year program, we always recommend students to sit for the CCSP or the CCS based on the 4 different coding courses that our students take within the program. The American Academy of Professional Coders also have their own credentials. They have the CPC and the CPCH, and those are for the Certified Professional Coder. And again, one then does sit for a national exam to obtain those credentials. The SCC, which is the Shoreline Community College Health Information Instructional Content, includes careers in health information in hospitals, clinics, and other health facilities, including non-organization type of settings. Focuses on health record systems, which is then the electronics health record. Emphasizes the collection, management, analysis, and presentation of patient data, and extensive training in hospital inpatient and ambulatory care coding and reimbursement systems. The curriculum is general education, which encompasses English 101 and Math 98, which is intermediate algebra. There's business and healthcare computer application courses such as Excel and Access. There's medical and sciences such as pharmacology, human diseases, medical terminology, and anatomy. Coding and reimbursement courses are 4 coding courses from basic ICD-10, basic CPT, to intermediate and advanced, as well as a reimbursement course. Students also learn health record content and systems, inpatient acute care, long-term care, outpatient, and home health. There's also a focus on data collection and analysis, quality improvement in healthcare, and management principles. Online class methods. College uses Canvas for the online platform. There's also online tutorials available if you haven't worked within the system. Instructors are always available to assist. The instruction focuses on written or recorded lectures, PowerPoint slides with audio, online activities, textbooks, electronic medical records, and hands-on use of the health information software. Testing and assignments are completed online, and various additional online technology is used, such as Near Perfect Electronic Health Record System and Panopto. Hands-on practice, there's course projects, online health record, there's analysis, coding with ICD-10 and PCS, and CPT. We use the online grouper and encoders, which are the online code books, and those systems also group the records to various payment groups. There's clinical documentation improvement software as well. We use Near Perfect Electronic Health Record, and this clinical practice were available for HIT students. That also encompasses online activities, hospital and non-hospital setting visits. Program prerequisites. There are 3 main prerequisites that are required for entry into the HIM program. The first is Biology 1.7, Human Biology, and it does not contain a lab, meaning there's no physiology lab component. All 3 of these require a 2.0 or higher. These are either based on prior completion or based on placement testing for math or the English courses. The biology course, anatomy course, if taken previously, must be within 10 years, and it must have been taught by a biology instructor. If you test higher into Math 99 or so forth, then you don't need to take math. However, if you test lower than the Math 99, then you must complete up to the Math 98 intermediate algebra. English 101 is based on testing again, and basically if all students entering the program or completing a program at Shoreline are required to have completed English 101, English composition, so one cannot test out. There is no time frame in which you could have completed these previously, so they can be 10, 20, 25, 30 years old. If you're unsure about your computer literacy skills, you can take computer applications course to enhance those if you feel. But the 3 main prerequisites again are Biology 170, Math 98, and English 101. So how do you get started? First, you complete the free Shoreline Community College application, which is located on the Shoreline Community College website to obtain a student number. Applications for entry into fall HIM programs begins each January until the end of June, so you do want to follow the instructions on the application. One official transcript is needed if you've attended previous colleges, universities. That must be sent along with the application. And the HIM faculty advisor will evaluate the course equivalencies at the time of the application. Copy of the assessment results for any math or English placement if not previously completed, and a $20 application fee is to be submitted with the application. Time frames and approval process. The health information faculty and advisors will work with you on planning your career in health information management. And once the application is received, the program director notifies the candidate in approximately a month's time. Accepted into the first year, all prerequisites are met, or a tentative acceptance into the first year after pending items are met. So what that means is that students are accepted into the program based on the completion of the prerequisites. If students still need the prerequisites, then a plan is developed that encompasses those prerequisites to move the student through the program. Do continue to check the Health Information Program website for updated information on HIIM program and application process. So what to do while you wait? There's many courses available without formal admission while you await entry. We have plenty of students sometimes who need to complete some prerequisites. So in the meantime, you can take additional courses as well, especially if you have a financial aid that requires a minimum of credits to be taken each quarter. These courses encompass Bio 170, Human Biology, English, Math courses, Computer Applications, Medical Terminology, Access, Excel, Human Relations, Accounting, Multicultural Issues, Survey of Healthcare Delivery, Legal Aspects of Healthcare, Pharmacology, and Human Diseases. And then technology. So evaluate the age of your computer. Look for the screen resolution of your monitor. Determine your internet access. Browsers can be any of these. However, various software will use certain types. We technically advise Chrome and Firefox to be the two highly used. Look to see what version you have of Windows, Office. We're going to utilize Canvas, Panopto, and other software systems. Instructors are available via Skype or Zoom. Make sure you have some firewalls and virus detectors. Determine your office supplies, such as paper and toner. And if you have there's a frequently asked questions, sorry about that, on our program website for details about software needs, etc. So that is it for me. If you want more information about the programs here at Shoreline Community College and the Health Information Department, feel free to reach out to us. We're available to answer any of your questions. We can also review any of your transcripts and create a plan moving you forward in the much rewarded Health Information Program. Thank you and have a great day.